Wolverhampton were part of an early support pathfinder since 2004, and I think in those days it was about trialling different systems and trying to find our way about how multi-agency services could work better for families. So a lot of it was experimental to start with, but as the years have gone on, early support has become part of our way of working. It's embedded in all our practice, from the point where a child's referred right through at the very point of diagnosis, or even before that, right the way through about how we can get services to coordinate the best approach for that family.
And what's made a big difference to families, they tell us time and time again that they don't have to tell their story over and over again to different professionals. They meet a group of people, tell them what's happened, tell them their story, and they don't have to repeat it to different professionals each time they have an appointment.
Well, I think where early support's been really effective in Wolverhampton is that it has really built the confidence of parents to work really well with professionals, to feel like they're an equal partner with professionals. I think it's been good the way that they've been able to choose who their key worker is, and so right from the start they felt as if they're in control, and I think that's created a real partnership work with professionals. And I think having established that relationship and that way of working, whilst things will inevitably change as their child gets older, I think that's a really good foundation which should help working in later life.
The fact we are actually based here in the GEM Centre in Wolverhampton, which is a multi-agency centre, which is a hub, a single point of referral for all children and families across the city, where they can come and find all the services that will support their needs, is pinnacle to how we deliver services within Wolverhampton. I think the key working aspect of early support, which is one of the focuses of the principles, is embedded into all the work that we develop with families. And giving parents that ownership and that choice of who their key worker within the key working system will be is a big driver for us, for actually parents being involved from that day one, and it being a system that works, that is not done to them, but it actually works with them.
Partnership is a real strength in Wolverhampton. We've got really good partnership approaches, and not just the building allowing us to do that, it's embedded across our work, and parents and carers are very much part of that partnership. We've got a very active Parents Forum, Voice for Parents Wolverhampton, which is a group of parents, all of children with additional needs, who all sit on strategic groups and help all of us who are making decisions to shape those services and give their views. And that's really good for the parents.
I think it's making the parent at the heart of it. And I think that is so important, because we might know about a bit of the child. They know about their child. And it's about doing that with the parent and empowering the parent. I think that is the most positive thing that's come out of early support. Actually working together with the parents, it does save time in the long run. In the short term, it might seem that it's quite difficult to achieve, but once you start working together, you won't go backwards. If I use an example of a parent who was very reluctant to accept hearing aids, now we try and fit hearing aids as soon as possible. This parent was very much against it. So what we did is we gently worked with them with early years support, with the physio, and I went in to see the parent, and we were actually to say in a gentle but professional way to the parent what the child's missing out on. And when we were able to demonstrate that, and then the hearing aids were put on, suddenly it was, I understand now. And that was the child's response. When the parents saw the child's response, it was then we were committed to hearing aid use.
I have to be honest and say that sometimes a child will have a condition that one specialist will want to treat in one way and physiotherapy may want to treat in another way. So an example might be a child who has got difficulties with their vision to their left side and also has difficulty using their left side. And they may be advised to use their vision most on the right side, because that will enable them to focus on things. From physio, we would want them to be stimulating the left side, and we would certainly work together with other members of the team so that we can give logical advice to families, because it's not always that easy to decide which is the right way forward. But Team Around the Child gives you the safe approach to that, really, so that everybody feels able to discuss things with each other. And if we can't tailor our advice to get it consistent for a family, then how can a family make sense of it? I think to take the early support approach actually reinforces the principles of good therapeutic management for the child. And I think that any child who's got a complex condition, the family at the beginning find it is really hard. They are told some really difficult things. There's a lot of words that are used that they're not familiar with. And therefore, if you have a whole team who understand what's going on, it very much helps to support the family and to enable them to be proactive in their child's condition from quite an early stage. We have some children who have been on special care baby unit for quite a long time and have had a lot of intervention while they're there and a lot of support, and they've been in an environment where they feel safe. And when they're discharged home, they have a fairly high anxiety level sometimes. But, you know, as a physiotherapist, I feel I'm privileged to have the knowledge and skills to be able to teach the parents how to position that child, to enable the baby to be more settled, to feed more easily, and to be positioned more comfortably so that they're happier in their environment. But actually, if you take the early support approach, everybody within the team knows that as well.
Thought right at the beginning it was a common sense way of working. We immediately saw the benefits of bringing everybody together, and it does save time. It's better for the family. When I see a child, I don't have to then wait for the speech therapist to write back to me to say what they're doing. If we're all meeting together, I know straight away, and I can say, well, maybe we can work on this, maybe we can work on that, and it just saves lots of paper, lots of correspondence, and we just all get everything together straight away. I've got a child that I'm actually still key worker for who's now in a mainstream primary school. He's got cerebral palsy, and he's had key working since he was about 2 or 3, and it works absolutely brilliantly in the primary school, and we still all meet together as professionals. How often depends on what mum says, so the actual frequency of the meetings are based on what the family need. And what saves time as well is because we set integrated goals at the meeting in school, the teacher has exactly the same goals that the professionals do, so it just brings everything together beautifully. The family don't end up with 100 goals that aren't achievable. I don't have to stick in extra clinic appointments because the child's asthma's gone off. I can sort things out straight away, advise in school about asthma, sort out inhalers, and that actually saves time for me. So it saves repetition in services, and you may find at a TAC meeting that there's a problem with a child, but the children's centre can pick it up. So you don't have to provide that service from health because it's already there in the children's centre. And just going to the TAC meetings meant we've learnt so much more about what's available for families across the city. I think we need awareness raising amongst our commissioners, because in health now we're going to be commissioned by clinical commissioning groups, and raising awareness of the value of this amongst those groups is essential.
I mean, I think the challenge at the moment, as everybody knows in the public sector, is we're all strapped for cash, aren't we? And there is a real danger in that situation that services are actually getting cut, getting diminished, and that we're in a downward spiral rather than an upward spiral. I think for me, I very much see this service as an early intervention sort of investment, that if we can get this investment right earlier, it will actually help families to not just manage but thrive and be more self-sufficient later on. I mean, one of the things that parents have talked to me about is they've used that phrase cliff edge as, you know, what they feel when their young person reaches adulthood and suddenly all the support they're used to goes away. And there is a real difficulty there because the statutory framework for supporting adults with disabilities is quite different from the framework for supporting children, and there are all sorts of, you know, means of testing, eligibility requirements about, you know, what it is you're expected to be able to do for yourself, which are quite different in adulthood, and we need to prepare families for that. We need to try and avoid that cliff edge and empower families to, you know, get the best for their young person in those new circumstances.
I think what we've done so far in Wolverhampton is we've embedded the whole principles of early support from birth to 5, and we feel very comfortable within this authority that we have those principles there. I think where we need to go now with early support is embedding that whole principles right across the age ranges, and strategically both within the local authority and the health authority. We're hoping that the sort of the processes that we have in place will really take us down that route, that we can not just take it to 19 but right through into adulthood, because for the families we work with it's a long life journey for them. And cutting it off at 19 and even 25 isn't the right way forward. It has to be right the way through.
Yeah, early support isn't early years, it's getting in early and giving the family all the support they need.